Good afternoon, everyone. Welcome to our webinar. I'm Jessica Miller. I'm with Medicodio. We are an AI-powered agent providing medical coding to ambulatory surgery centers, hospitals, and physician offices. Today, our presentation is going to cover how you can increase your medical coding efficiency using artificial intelligence in ambulatory surgery centers. I'm going to give a nice overview of the product that we have at Medicodio and our solutions, and introduce one of our customers, Green Mountain Surgery Center, and give a little background on their industry, their impact in the industry. We'll also discuss some of the challenges that they face before implementing Medicodio, and share how some of our key solutions have impacted their coding processes. As I mentioned, I'm Jessica Miller. I am the product evangelist at Medicodio. I've been with the company since its inception in 2021. I am a certified professional coder with a background in revenue cycle management and healthcare management. And I also have the pleasure of speaking on artificial intelligence, machine learning, and medical coding technologies at some of the nationally recognized conferences. I mentioned, joining me today are Erica Dumont and Rachel Pascal from the Green Mountain Surgery Center. And Erica and Rachel, go ahead and give us an introduction.
Yeah, definitely. So I'm Erica Dumont. I have about a decade in experience with revenue cycle and medical billing. I was brought to GMSC about a year or two after they opened when they wanted to bring the billing in-house. Previously, they had outsourced it. So I've just been the subject matter expert for that. And then eventually I became the business office manager and billing manager as well.
And I'm Rachel Pasquale. The majority of my career has been in finance and ops in various industries around the world. I came to Green Mountain Surgery Center 4 years ago. We're only 5 years old, but I'm the director of HR and marketing, which doesn't necessarily, you're like, why are you on this call? And I've been a member of our all-female leadership team as well this entire time. I have my BA and MBA from New England, but in global management as well as finance. And I came into medical billing and coding, like maybe many of you on this call, which cost drives many factors in an ASC for all of our decisions. And so my passion is around small businesses and operational efficiencies. So when our CPC was going to take another job at another business, I stepped in and I was like, I'll learn how to code for the center. And I've been doing our coding ever since June of 2024, maybe slightly before then.
Yeah, fantastic. And not a rare story for many coders. You come in, you start in one position, and then you get pulled in inevitably into revenue cycle management. So
yes, agreed. And I can also give a little background about Green Mountain Surgery Center as a whole. So
please do.
Like it says on the slide, we are the first multi-specialty ASC in the state of Vermont. There is an eye surgery center here. We have been named to Newsweek's Best Surgery Centers in America. We are top 5 for 2 years in a row for the New England region. We have 2 ORs, 3 procedure rooms, and 1 exam room. The types of services we do are GI, ortho, hands, pediatric and special needs dentistry, OBGYN or GYN, general surgery, eyes, and plastics. We roughly do between 600 and 900 cases a month. So yes, we're Medicare certified, Joint Commission accredited, and we have implemented Medicodio in June, so last summer.
Fantastic. Thank you for that. Yep. So a little background about Medicodio and why you're all here to learn about our AI-powered agent. So we're on a mission to provide an innovative and efficient coding solution to medical coders and providers in healthcare organizations like ambulatory surgery centers, and also applicable for revenue cycle management companies or any healthcare organization with a large coding team or billing stream. We're leveraging that artificial intelligence and machine learning technology to ease the coding processes for our customers, minimize their coding errors, and speed up turnaround times in claim submission. Our goal is to save valuable time and financial resources in these facilities, reducing the need for extensive human training or turnaround while maintaining the accuracy and quality in the medical coding. We know that technology enables us to do this by bringing efficiency into those repetitive tasks and automating those processes, which can allow resources to be redirected to more value-added tasks. Medical coders spend a lot of time reviewing documentation and making code selections, and a lot of that information draws our attention away from other valuable things to consider in coming in the revenue cycle. So at Medicodio, we wanted to use that technology to transform the role of those medical coders, enabling them to contribute more effectively to the organization's mission of providing excellent patient care through efficient billing practices. I mentioned a lot about the technology, and that's a huge portion of our team, but we're also standing out in the industry because we employ our medical coders and designers to enhance the accuracy and efficiency of our platform. We were constructed using cutting-edge technologies like artificial intelligence and machine learning, but are also able to bring in robotic process automation, automatic process integrations, and also our proprietary knowledge base. So unlike other coding softwares, Codio is more than just a code reference tool. We're bringing in those automated tasks to bring in that efficiency in the coding process and reducing the need for all of the manual intervention and resource, time-intensive resource and researching that it takes to arrive at a code selection. So as I mentioned, we are an intelligent software. We are built utilizing that artificial intelligence and proprietary knowledge base. And our system can actually predict the codes by reading the patient chart and demographic information. A little bit more how that looks. Utilizing the RPA or API integrations, our platform can actually access your EHR billing system and identify the patient registration and record information that it needs to arrive at a code selection. It can filter that information and identify those portions needed for code selection, and also assist your coders and providers in clinical documentation improvement by identifying certain areas where there might be deficiencies or coding information could not be obtained due to a lack of documentation. This information is pulled into our platform where our proprietary engine analyzes and provides those code suggestions. At this point, we can move to a phase of automation where your coder comes and validates those claim selections and begins to build that claim within our platform. That information is then automatically transferred through the API and RPA integrations back into the billing system, reducing the need for manual entry and data transfer. And then, of course, through that artificial intelligence and machine learning, the accuracy and enhancements in the product are achieved through that direct user feedback. Specific features of the platform are that it is EHR agnostic. So we are able to integrate regardless of what billing or operating system you're utilizing. We're also specialty agnostic. We have the complete set and code library of the ICDs, CPTs, HCPCS, and modifiers, as well as the general coding guidelines to ensure that our machine is following the appropriate protocols for code selection. That full code set library is complete for all of the specialties and settings, allowing us to scale the product irrelevant of which facility, healthcare location, or region we're going into. Also built into our platform are automatic LCD and NCCI edit checks. These allow us to arrive at code selections and build those claim details in a more efficient manner by showing the coder the information necessary, and in some cases, even filtering out that information based on the LCD and NCCI edits. Along with the code engine, our platform has detailed reporting and a dashboard with customizable views to allow the user to showcase the health of the cases within the system, plotting their charts as they move through the platform, as well as seeing demographics and statistics related to producers in terms of the providers or healthcare facilities in the network. We also spend a lot of time on UAT development, ensuring that there's not a lot of manual processes or need to navigate to additional sites for research information. With simple point and click features, the coder makes the final code selections, can get rationale on code assignments, and build the claim details. All of this, of course, resulting in the manual workload reduction and allowing the energy of the coder and subject matter expert to be focused on more value-added tasks in the revenue cycle. We offer these solutions through 2 phases to automation. These powerful AI agents streamline and optimize the automation process through seamless integration with any EHR or billing system and can accommodate specific payer contracts and EHR or clearinghouse requirements. In addition, they each feature customizable rule engines to ensure that billing is precisely aligned with the contract terms. We call these agents our co-pilot and our autopilot. In our co-pilot solution, the artificial intelligence agent provides code suggestions based on the documentation. So it will read and analyze the information and provide those ICDs, CPTs, HCPCS, and modifiers most appropriate for the documentation, report type, and setting. Coders will then access the software to finalize and build those claim details. They see the code suggestions, they make the final selections, and are able to see any relevant information related to the NCCIs or LCD edits. They can also verify the customization for the rule engines and apply any additional sequencing or coding guidelines as necessary. Copilot is the bridge to automation and allows them to automate their coding workflow and accelerate their code selection by having those pre-approved suggestions. This differs slightly from our autopilot agent. In this instance, the autopilot agent automatically assigns the appropriate code selection based on the documentation. So in this instance, the engine has arrived at the code suggestion and also finalized that selection to build the claim details. In this instance, your subject matter expert, coder, user, or provider only needs to come in and verify the claim information, and it will already have run those NCCI LCDs, and you will verify that the code rules are appropriate and approve those. That information is then saved to a database where that can be automatically transferred back to the EHR claim system. So this cuts down on your coding turnaround time and maintains the consistency and accuracy of your coding. Also mitigates some downcoding or upcoding potentials, given that the solution will weed out or verify those selections based on its intelligence and engine. So our clients are seeing improved efficiency and code accuracy through use of our platform in time saved in that tedious data entry through those RPA and API integrations. Coders only need to review the suggested codes and approve the information based on the claim details. It doesn't require any learning curve on the EHR or practice management system. As a standalone platform, the coder users have all the information directly in Medicodio at their fingertips and don't need to navigate to additional platforms or even code resources or additional tools to verify NCCIs or LCDs. It increased efficiency as Codio improves over time with that machine learning. And additionally, our direct user feedback in partnership with our customers allows us to take into consideration their enhancements or features that they need to see to bring efficiency into their coding processes. And because we're utilizing RPA and API technology as well as artificial intelligence, we have faster reports processing where our engine can read and analyze the documentation and provide a code selection within minutes of receiving the information. So specific to Green Mountain Surgery Center, they've been consistently on the forefront of innovation in patient care. As an early adopter, they embrace cutting edge technologies to enhance patient outcomes and increase operational efficiency. And with the adoption of Medicodio, the premier platform for integrated medical coding, Green Mountain Surgery Center has continued to position itself as a pioneer in the healthcare industry. Now, as an ambulatory surgery center, specific in the healthcare industry, there are certain challenges that they face, specifically with maintaining high patient volumes with limited resources. Ambulatory surgery centers have to operate on very thin margins, and they're paid at a rate reduced from standard hospital outpatient rates. So they really have to maintain an aspect of quality and efficiency without all of those same resources that are in larger healthcare or facilities. Along with this, their reimbursements are tied to the accuracy and efficiency in their coding processes. With those reimbursements being reduced, they really have to streamline and ensure that they're capturing all of the appropriate charges in regards to implants or as it may relate to a contract requirement for a specific ICD with the CPT. Indeed, to do all this will also reducing operational inefficiencies and delays. Any change or falter in the process has an impact on how quickly a claim can get out and how soon that reimbursement will come back into the facility. Along with that, we're all aware ambulatory surgery centers are highly regulated industry, so they've got specific regulatory and compliance requirements, even specific to contract and payer specifics. And they're always looking for ways to improve financial performance and return on investment. And the implementation of artificial intelligence technologies outside of revenue cycle management, but specifically within coding and billing, allow them to bring more efficiencies into the process and really mitigate some of the challenges that might come in terms of finding appropriate staffing or even having availability of staff to perform the functions needed for patient follow-up and appropriate billing. And of course, under all of these cost pressures, they are still required to maintain high levels of quality care and also compliance with specific security and HIPAA requirements. So all of these factors, can drive a surgery center to look for ways to automate certain processes. And specifically for Green Mountain Surgery Center, when I asked them to be on this call, I really wanted to hear, from Rachel and Erica, what were the challenges that they were facing directly before implementing Medicodio? And, what are their thoughts on how that technology could help them alleviate some of these concerns? And Erica, I'll go ahead and let you start if you want to speak specifically to some of these and, how you felt that technology and as an early adopter in the surgery center industry would help you guys maintain that cutting edge.
Yeah, definitely. So a little over a year, maybe like a year and a half ago, we decided that it was time to bring our coding in-house. We'd already brought billing in-house. And so we started with the hiring process, which was actually, it was really, really difficult to find applicants that, fit our needs. Ultimately, we were unable to find somebody with experience in ASC coding because Vermont, we're the first multi-specialty ASC. And we were also looking for somebody to work in-house, not remotely, because we were developing this process. We wanted somebody here that would work with us hands-on to build it from the ground up. So that was, really hard to find somebody for that position. Ultimately, we hired somebody, and just throughout that, I noticed a big gap in knowledge, and like the ability to help us bring it on just really wasn't there. So I started thinking what are we going to do? How are we going to preserve this knowledge? Because we only had one coder and it's hard to have just one person when it's not quite a full-time job. And in previous roles that I worked at, we had one person doing a specific task. And when they up and left, there was nobody that knew that knowledge. So I've always been very pro transparency, pro resources, kind of having all that information out there. So I started looking into how we could do that. And I came across AI coding and computer assisted coding. And it just seemed to really, fit the bill. It was a great way to capture all of our knowledge and keep it in a system that is ours versus a person. And with Medicodio, we've been able to feed the system a lot of that information, which now preserves it and allows anybody in our center to access this, utilize it, and ensure that we have kind of preserved that information.
Absolutely. Like you said, when those people go, the information goes with them. And sometimes that can be just as simple as knowing a specific payer requirement on a contract. And if that gets taken with that individual, it's not until those denials come in that you might realize, hey, we've overlooked something here.
Yeah, there's definitely a lot of work that goes into training staff, retaining staff, all that stuff. So looking for a solution where we could kind of preserve it in something that we own, something that we, built up with Medicodio as one of our resources and tools. It was fit the bill.
And can I speak a little bit to, I can speak from the leadership team perspective where both Erica and I use AI in our normal day-to-day, which was easy for us to adopt and even go out and look for AI coding. But a challenge was also how do we go back to the team and get them on board? Because healthcare in general, you want information to transfer safely, HIPAA and whatnot. So that was also a concern and a consideration we had when thinking about switching to AI coding or even jumping on this bandwagon to go explore it. And so
and
that
knowing,
was, yeah.
and knowing during those times that some of that information could have easily also been updated or changed. So while your physicians, they've got very specific ways they document, if there's something in the guideline or something that comes from the payer, that's a whole additional educational process that comes through. Yep.
Agreed.
Excellent. And that kind of speaks to, some of that consistency and accuracy in those coding processes. And as you mentioned, you're dealing in a multi-specialty facility. So the consistency can be kind of hard to achieve, depending on what day and what surgeries are happening. Those kinds of things, just speaking from a coder's perspective, when I had to do that, I liked to know, like, I'm getting all of these cases at one time, because the rules and the guidelines change for the different specialties as well. So,
yeah. And sorry, I don't mean to interrupt you, but another challenge that we did face is our EMR is very hard to integrate with. So another aspect we were hesitant to ever go towards was integrating anything with our EMR. And that was a big challenge because in the past, when we've tried with inventory management or anything else, it's been a roadblock. So, and ultimately too hard to overcome. So that was just another one of our challenges.
Yeah. And we're going to talk about that a little bit more. I didn't cover it specifically during the product overview, but what Rachel and Erica are referring to in our implementation process, is quite a lengthy amount of time that's spent, as she mentioned, gathering those customer specifications. So really what we tried to do when we engaged with Green Mountain is make sure that we were kind of forming a partnership. And we wanted to make sure that we're getting your feedback and finding those ways that the technology could bring that efficiency that you were looking for. And also, if required, you bypass some of those hurdles that come with specific EHR systems. And so kind of to recap that discussion, to ensure that consistency and accuracy, you turn to artificial intelligence assisted medical coding. And this approach has helped you preserve that institutional coding knowledge within the system, meaning that Medicodio has been able to integrate with your platform and implement those rule-based and payer-specific coding guidelines, rather than having to rely on an individual employee or somebody with their Post-it notes that might know specifics on a certain payer contract, but not have all of the coding knowledge required to meet the full service line. Along with this, artificial intelligence will perform the same task as directed. And this reduces the dependency on staff who might leave, take that valuable information or expertise with them, or even just, leave you in a position where you don't have a replacement and the work still has to get done. So the technology is there and able to operate and even provide you with the opportunity to scale without the need for additional individuals. Along with that, incorporating an artificial intelligence coding technology or agent like Medicodio improves that long-term coding stability and accuracy. Along with the platform, we have our automated updating. So Green Mountain has the benefit of knowing that the information they receive from Medicodio is current and up to date and doesn't require an individual or an additional resource to bring it up to speed. So this does bring in that stability in the coding processes and also ensures additional compliance with all the regulatory requirements. And so when I asked specifically, what it was that made Medicodio stand out from the other technologies that you reviewed in the revenue cycle management space. Some of the main things that you pointed out was that we were an affordable solution. We limit our contracts on a transactional basis, and we allow that for you to scale on an operational side without, again, that a need for additional overhead. We did bring in a very capable team of developers, RPA designers, and medical coders to assist in understanding the nuances of your contract specifics. As you mentioned, you also appreciated the real world demonstration. And I'd like to get, Erica or Rachel, your feedback specifically on what that meant for you and how it played into your decision.
Yeah, so we looked at around 4 different AI solutions, and all of them except for Medicodio were not willing to show us a real life or a real demonstration with our cases, which I thought was very telling in itself, because I just find Medicodio very transparent, and they're like, we can do this and we're going to show you and here you go. So that was a really big a key factor in our decision, which was we were able to actually see the solution, not just on slides. And from Medicodio talking about it, we were actually able to look to see like, oh, this is what we coded it ourselves. Oh, okay, they actually have something similar. And then we had a really intellectual conversation about the different cases, and the knowledge was there on Medicodio's side. And that was a key selling point for us.
Exactly. Well, we have a very thorough demo platform with all types of specialty cases. But really, when it comes to deciding if the artificial intelligence can handle your specific load, it's those trials and actually seeing your documentation come through the platform and ensuring that it matches with the expectation of what was actually billed. And that's just really hard to showcase, again, like you mentioned, without that real world data. So those were factors that came into play, prior to making the decision. Now that you've been a customer for a few months, some of the other things that you had to say about the product that we appreciated was our exceptional support. We do have our support ticketing system 24/7, but can you give me a little bit of background in your experience in working with the support team? How easy is it for you to connect with us? And, what kind of comments do you have in regards to responses for that?
Yeah, so I really, really appreciate the responsiveness from Medicodio and the support. I email support and I get instantaneous feedback. I know when it's going to be resolved. I know any enhancements where the roadblock is potentially for them and or me, or any clarifying questions. We get to the bottom of the problem pretty quickly. And then next day or 2 days after, I see the enhancements right away. So in terms of responsiveness, it is very quick and very efficient, and communication is key in any vendor partner relationship. And I feel completely supported from that standpoint. And also, I think that some of our conversations and the support that we've had overall has been, I really truly feel like Medicodio and us are on the same team, which I appreciate from a business perspective, as well as just trying to really make us as efficient as possible and save our time. Because in reality, we were doing this prior ourselves. We can do it ourselves. So it's just a matter of time, and like I have 4 other jobs within my role. So there's many things I could be doing with my time, and Medicodio makes it so much easier to do coding for 600 to 900 cases a month. So it's a great tool, and the support has been appreciated.
Excellent. And we'll cover a little bit more on those time efficiencies coming up here in a few slides. We'll discover some of the return on investment that you guys have found. But just to wrap it up here, as you mentioned, with that exceptional support, part of that collaborative partnership is having those weekly check-ins. So, each time we're taking on a customer, and something that's been very effective with Green Mountain is maintaining that open channel of communication. We want to hear what's good, what's bad, what we can improve on. And really that just not only builds that trust and partnership, but it gives us the opportunity to set new goals and achieve new things for the platform. So looking again at that implementation process and some of the outcomes, some comments that you had for us in regards to the implementation process was that it was smooth and collaborative. We did initially set up that support ticketing process and those weekly check-ins so that you could quickly and easily communicate with us. Our customers get that dedicated support team, but also a dedicated individual, whether that's on the coding manager side or through the RPA team side. There's always going to be an individual that you can reach out to with those concerns. Now, seamless integration into our existing processes with minimal disruption. This is where I'd like to get your comments, Rachel or Erica. As you mentioned, your EHR system can be somewhat tricky to provide those implementations. So what specifically, was your concern, and what was it that Medicodio was able to achieve that helped mitigate some of those challenges?
Yeah, definitely. So our EMR is surgical information systems, and historically they have certain products that they partner with to integrate. So anything outside of those, it's like a big no-no. And I think the computer assisted program that they had partnered with was like 3M or something. And we did outreach to 3M and tried to do a demo with them. And they never responded to us, even though they had told us that one of their goals for the year was to partner with ASCs. So, I mean, in general, finding anybody that can integrate into SIS without actually working with us to do it, it's very complicated. So the RPA solution was great, and it was really, really easy to set up. Like we were surprised by how easy it was, because everybody's like, oh, we have other ways of doing this. We'll be able to integrate. And then I know with past projects, it wasn't like that. But when Medicodio said they could integrate and that it would be quick and easy, it was just a few meetings, a few things to tweak, and it went really smoothly, and it's been working very well.
Excellent. Yeah, those integrations, they can get very challenging. But really what we want to ensure is that we're mimicking those coding processes. We don't want to see any interruption in the operational flow. And I think we were really able to achieve that with you guys, thanks to your collaboration and willingness to also share, how those processes were happening, your understanding, because before you go on this journey of artificial intelligence, you really have to understand what your processes are, where the inefficiencies are, and what different ways you can mitigate those through the technology. And so having partnerships with Medicodio where we seek out solutions for things like RPA and API integrations is going to be really important when you're looking at a coding solution.
Yeah, and I just wanted to add that when we did bring this on board, we're bringing it in-house. Yes, we're still using Medicodio, but it was really important to us to understand what was going on the Codio side, so that transparent and open communication and the weekly check-ins and the support team were crucial to this because it also pushed our team to be like, okay, what would someone need to do, or what would a bot need to do to come into SIS and go through each step to actually pull the chart. So it also helped us deep dive into our own processes. And then to Medicodio's credit, we say it was easy. You guys did it probably was easy. You're an extremely smart team, but to us, you guys definitely took it in stride and bared with us as we tried to figure out exactly and articulate exactly how someone might pull it, and then also how to put it back in so it moves on to charge entry. So it was appreciated. Thank you.
Yeah, it's kind of a learning experience for everybody because you do it every day. So you think, oh, it's just the same way I'm always doing it. And then when you try to teach it to somebody else, that's when you understand, oh, there's a different nuance here, or this claim maybe has to be split, or this charge has to be reassigned to somewhere else. And all of those things, the intelligence isn't going to know without getting that appropriate training. So it's helpful to have worked with such a dedicated team on Green Mountain Surgery Center side because you guys knew what you were looking for, knew what your processes were, and then along the way, we're open to having discussions about how we could change things to make it more efficient. Moving on, the ultimate goal in an ambulatory surgery center is obviously a seamless direct-to-bill workflow in the revenue cycle. From Green Mountain Surgery perspective, this involves Medicodio's platform automatically pulling the data into the engine, providing those code assignments, and then having that flow directly into the biller's charge entry screen for review. Efficiency in their coding processes allows them to be more accurate and timely in their billing. And that, of course, impacts the time frame in which those reimbursements come back to the ASC. And as I mentioned, some of those contract and payer specific challenges can really have an impact on the timeline for that reimbursement. And the sooner that money is back into the surgery center, the sooner it can be used to improve the operations and patient outcomes. Those operational enhancements allow them to scale their service lines without additional overhead considerations. Initially, starting out with using the platform in some of their specialties, and once we see proof of product, they're able to roll it into other specialties without, again, the need for that additional person. There's no retraining required of the engine. It already understands the processes. So we're really giving them an opportunity to scale that information, bring more cases in, and have more coding completed by the engine just through its understanding of their current processes. So once fully operational, because they are in a co-pilot and autopilot phases, so they're getting both of our solutions. Ultimately, the goal, of course, is to have everything run through the autopilot, bringing them to a full automated phase. And once that is operational, the streamline process is going to eliminate the need for any manual review within the separate coding queue. And that, of course, in turn, will free up valuable staff time and resources, obviously contributing directly to the return on investment. And Rachel, you had a comment earlier, in terms of that time management and where you see the platform bringing in efficiencies in your job or your workflow. I'd love to hear your specific comments on that.
Yeah, so in the beginning, I was doing a little bit of coding, still within SIS, our EMR, and then obviously with Codio going through the implementation process and working to improve the efficiencies there, I would probably spend, in addition to my other job, my day job, I would spend probably 10 hours a week working through, trying to make sure everything's accurate, maybe even more. Because again, I'm not a CPC, and I didn't have the background. I wasn't fully immersed in all the clinical stuff that we do. And then as now, I mean, I maybe spend 4 hours. It's very quick, and then my knowledge has increased a lot. And I can, I find myself going to Codio way more often to, instead of, I'm sure I could go to the ICD website, I could go to Medicare, I could look up many different codes, but I choose to go into Codio because I really like the way the tool is built, and how the information is laid out. So if I want to do any other research, I choose to do it within Codio.
Yeah. And that's that complete code set library that you mentioned. We do have all of the surgical specialties, all of the ICDs, all of the guidelines. And then additionally, as a resource tool, because coder users are using this, we've built in those excludes and excludes. So if you're already familiar with other coding resources or even using a print or manual CPT book, we wanted Medicodio to mimic that. And that really brings in that ease of use because you can see the code assignment, you can get the code information, and you can understand, where in that documentation the code selection is being derived from. Helps you to learn and understand specific codes. It can also introduce you to other specialties. So, one of the benefits of being an AI agent and also a coder assistive tool is having that complete code set library. As you mentioned, those key contributing factors to the return on investment, that coding accuracy and consistency. The machine is understanding the guidelines, it's applying it for every case as specific to what you have trained or given as the guidance. Of course, this leads to fewer denials from specific from specific payers for contract, specific requirements like a missing modifier or an incorrect sequence in the ICD. This also allows for those increased clean claim rates. I mentioned it is a lot of that rule-based coding, and having an engine that can understand and apply those rules consistently obviously has an impact on all of those denials and clean claim rates. And then, Rachel, as you mentioned, this allows your staff to focus their time on other value-added or critical tasks. Surgery centers have to run efficiently on, sometimes fewer staff or less staff, or even with staff performing several different roles at the same time. So it's critical that their time is not wasted on looking for additional information or tracking down documentation, or even just the manual entry of codes into an EHR system. All of that will help you achieve your enhanced overall operational efficiency. Again, looking at how all of those factors interplay with each other. How soon is the documentation done? How soon is the coding done? How fast can the claim go out? How quickly can that reimbursement be recouped in order to contribute to those patient outcomes? Also, this artificial intelligence, one of my favorite parts is that reduction in administrative burden and staff burnout. When I was originally approached about the ideas of automated coding, the initial concern as a coder is that this is going to lead to a reduction in my workflow or in my career. And really, it was an opportunity to bring in an enhancement because now your coder users and your other staff can be focused on things that have that direct impact, and they can feel a real ownership in impacting that revenue cycle through not being burnt out and doing the same repetitive tasks over and over again. Coding can have some of that rote operational ability, and when you bring in artificial intelligence to perform those functions, it's amazing what other things those staffs can be doing. So we mentioned some of the product highlights. Earlier on, our platform is able to provide that automated code selection. We are able to customize to your payer specifics. We do have seamless integration into Green Mountain's workflow, and we're bringing that continuous support and enhancement. And I'd kind of like to wrap up this presentation with getting your final thoughts, Rachel and Erica, on these specific product highlights. What factor was most influential in the decision, and which of these has the most impact on your current job or responsibilities?
Yeah, I just wanted to mention one thing about the ROI and the enhancements you were talking about to staff. I think by exploring AI coding for us, it forced us to get rid of that single point of failure. And I think, especially in an ASC and with us, we have in all of our clinical staff, everyone's cross training. We don't want someone to be solely dependent on one thing.
Mm-hmm.
And coding was that bottleneck for us, especially when we went to look out at our coders, seeing that they were using AI. It's like, okay, why can't we? Why do we need to lose all control? And in this process, we have on our billing team many subject matter experts in the different payers, on the different just the different nuances. So through this process, we created an operational efficiency of a document on our side where of historical cases that we've coded from our own coders in the past, and then obviously now, but where we've had it by specialty, by payer, different codes, just all of our knowledge. And it was really pushed by Medicodio because we wanted to train the bot to basically be similar to myself, Erica, or anyone else on the billing team, so that there isn't a single point of failure, and of course in a cost-effective way. The other thing I wanted to mention was the customization that we're able to do, and I think any ASC employee on here can relate to this. So what we do for the Q1, which we're doing right now, is we were able to ask Codio to delay when they pull from our EMR into Codio. So we delay 3 days. We don't want to be the first bill that someone receives. We want to, let's let the doctors or somebody else put that in first, and then we'll come in later in hopes that maybe their deductible is more met and whatnot. And then we will switch back to our 2-day pull. But we're able to do that because Codio is accessible. It's not this unreachable, unattainable company to work with, which is what we found in our vetting process of the other companies. And that was really important for us to work with a team that was actually going to work with us and relate to our problems that we were going through and then create that efficiency.
Yeah, that's great to hear because we do put a lot of emphasis on problem solving, and we do have a thorough belief that technology can make things fluid. We're not an EHR, we're not a direct to clearinghouse. So as I mentioned, as a standalone platform, we are providing that coding, but we do bring that customization of understanding the payer rules, and we can train the bot to push and pull that data, as you mentioned, per your schedule. So if there's something that's advantageous about the data at a certain time or finding ways to do it more in real time, those are challenges that we like to have our tech team rise to because, again, they're all things that enhance the product and bring in those efficiencies for our customers. So that's great to hear.
Yeah, and for me, the biggest deciding factor with Medicodio was the affordability. There's just so much value in it compared to other vendors that we vetted. And one of my biggest concerns with this was implementation. We've just had products before, like there's one product from 1.5 years ago that I'm still not fully using from another company because our implementation team just left us before I even got it working. And with Medicodio, I mean, with other companies, the implementation cost was $60,000+, really, really expensive. And with Medicodio, we've gotten $60,000 worth of implementation support without paying even a fraction of that. So the support's been great. The value's been great. It's just been really amazing. And it's grown a lot since we started with them as well. Like their platform is starting to look like those bigger companies where it's really aesthetically pleasing. Not that it has to be, but like it looks great. It's on par with the bigger companies now, but they just work so closely with us and meet our needs. And they're so accessible and affordable. Just, I mean, they're like they're everything an ASC needs. When you're looking for low cost solutions, it really aligns well with ASCs, I think.
It pleases me to hear that because that's where my background was. That's, where we thought initially, because everybody's looking for a niche market. Artificial intelligence was heavy in radiology, but we saw a real opportunity, as you mentioned, to be that cost affordable, or cost containing and affordable solution for ambulatory surgery centers, understanding the specific challenges that you have in overhead, scalability, contract specifics, finding something that can work quickly and easily, and understand that it's not going to be the same thing every day because it's multi-specialty and, anytime a payer change could come along, that's going to impact the entire revenue stream. And you want to, implement those things on the front end and not catch them as they come in as denials on the back end. So final thoughts. By leveraging Medicodio's capabilities, Green Mountain Surgery Center has streamlined their processes. They've seen a reduction in their administrative burdens, and they've elevated the accuracy and efficiency of their medical coding, ensuring their top-tier patient care while maintaining regulatory compliance. As early adopters, they've not only redefined how surgery centers can utilize Medicodio, but they've also created a blueprint for success that other institutions can follow. And to speak to that, I really think that one of the biggest things that's impacted our success has been that open communication and really developing that partnership. And as you mentioned, finding a way to show that proof of product through the trial and give you a real world idea of how it was going to function in your processes. All of that kind of sets the stage for how we're going to communicate in the implementation and, what that's going to look like for ongoing customer support. So their commitment to advancing healthcare through innovative solutions solidifies Green Mountain Surgery Center's role as a thought leader. They're driving meaningful change within the industry and setting a standard in artificial intelligence medical coding. So I invite you to stay tuned to the Medicodio website. Go ahead and check out Green Mountain Surgery Center as we continue to share our insights and success stories and continue our webinar series with some of the best practices that will help to inspire and empower other ambulatory surgery centers and those looking to implement artificial intelligence medical coding. We do have just a few minutes left in the presentation, so I will go ahead and open the floor if there are any questions, comments, anything for the Q&A session. If you think of something or you want to connect with us later, you can email us at info@medicodio.com. We are also on the internet at www.medicodio.com. You can find myself and Medicodio also on LinkedIn. So that is at the LinkedIn Medicodio, and then also LinkedIn at Jessica Miller. Look forward to having you all with us again next time. And I want to give a really big thank you to Erica and Rachel from Green Mountain Surgery Center. It's fantastic what you guys have been doing for surgery centers and for the ASC in your state. And we are really excited to be your partner in providing this coding technology and having your feedback and figuring out ways that we can work together to continue improving our processes. Take a peek at what we have here in the Q&A. There's a question in regards to the pricing. So I'm happy if you want to reach out by email, I could share a full breakdown, but we do this on a transactional cost. And then there is also a charge for the EMR or EHR implementations that runs around $1,500 per system. So depending on how many facilities in EHR systems, we see that cost vary. but afterwards it is a transactional per chart or per operative report charge, with additional user fees for maintaining the database. Accuracy rates, they tend to fluctuate, again, depending on the specialty and the amount of data. Typically, out of the box, our system is at 90 to 92% accurate. We reach that 100% accuracy through the direct feedback with the coder, as well as ensuring that none of the cases go into that autopilot until we have enough accuracy to ensure that the coding is 100%. So another question. So yes, Medicodio can assist in the reduction of coding-related denials. The whole intent of the platform is that it is able to provide the appropriate document or appropriate coding based on the documentation. So our platform, because of those accuracy rates, does lead to a reduction in denials. Additionally, you're having the artificial intelligence review and provide those suggestions, and then that manual intervention or the subject matter expertise provides that extra layer of auditing. So you're kind of getting more than a one-level review of each case just by having those additional layers of verification through the engine. Medicodio has experience in every specialty. As I mentioned, our code library is able to pull regardless of specialty, setting, or regional location. Currently, we do evaluation management for physician offices, specialty care clinics. In surgery centers, we're working in orthopedics, spine, pain management, ophthalmology, gastroenterology, general surgery. We have some cardiovascular and even some urology and OBGYN. So pretty much everything, even if it's a specialty that we don't have a current customer, if something off the wall came in, we have the code set and library available. The accuracy in the first phases would be somewhat low, but we would see that increase through that knowledge-based training coming from the partnership with the customer. We are able to only support the ICD, CPT, HCPC, and modifier coding, either through additional like HCC or CAPS requirements. We can perform some OASIS coding. Additional might require specific modifications. So we do tend to keep things pretty standard until the customer engages, and then we can implement some of those customizations. So this is a question in regards for the learning curve for the platform. Traditionally, for rule-based coding, that is a 24-hour turnaround. In terms of Copilot automation, that could be anywhere from 2 weeks to 2 months, depending on volume. So of course, the higher or more efficient the feedback, the sooner we can bring those accuracy rates up. We can either achieve that, through historical data, test data. It doesn't necessarily have to come directly from live data. But if we're working just with live data, then, the timeline would be increased. I think that does wrap up our presentation. Again, I'm going to go ahead and share this final slide for those individuals. If you're looking to email us, you can connect at info@medicodio.com. Our website again is www.medicodio.com. We will be sending out a follow-up email to thank you for your attendance today. And then if there's any additional information, feel free to reach out or connect with me through that email or on LinkedIn. Happy to engage with anyone. I hope everyone has a great rest of their afternoon. Thank you so much for attending.